Welcome to our next installment of LCME and Me, a primer to help directors of courses and clerkship prepare for our LCME site visit. Today, we're going to talk about assessment. We're going to talk about how assessment is different from evaluation. What about formative and summative assessment? And what is it the LCME really prioritizes about these? So let's start with assessment versus evaluation. And these definitions are pulled from the LCME glossary. Assessment is really the method to use different kinds of data about whether a medical student has achieved the competency. So assessment is of a medical student. Evaluation, in contrast, is systematic use of a variety of different kinds of data about a program fulfilling its mission. So assessment is how the student's doing, evaluation is how the program's doing. So in other words, we assess students, we evaluate our curriculum, at least the way the LCME uses these terms. So when we think about assessing students, a lot of those assessments happen in courses. So you have different assessments in your course, such as an exam you give it to students, or other types of ways to measure how they're doing in the course, how they're doing mastering the material. We also use assessments outside of courses, such as the USMLE exam is a way that students are assessed for medical licensure. So we think about evaluating the curriculum. That happens within the course as well. There's evaluations of your course evaluations that go out to the students to gauge their perception with the course. We also use evaluations of our entire curriculum and segments of the curriculum. And we would term some of this program evaluation, where we're looking broadly at how's our curriculum doing? How are these different phases doing? How are we doing meeting our overall goals and objectives of our curriculum? And when we take assessment of students, we can break that further down into formative and summative. So let's unpack this a little bit more. So we have formative assessment and summative assessment. Well, formative assessment is really designed to point out strengths and weaknesses. So figuring out and helping students figure out what are they doing well, how can they improve? And so the purpose of this is really to shape their development, to help them continue to make progress and get better. The analogy that I think is the easiest to comprehend is the comments you might get back on your homework. Of you turn in your homework and then you get it back from the teacher and it has all the red marks, and that's the formative assessment about how you did and how you need to improve. Versus summative is comparing to a standard. We're saying, is the student at this standard or not? And so then we can use summative assessment to be able to make decisions. Is the student has the student passed the course? Are they ready to graduate? Are they ready to move on to the next level? So it's really, summative assessment is really focused on achievement. And the analogy here is the final exam grade. Did you, at the end of all of this work in this course, did you pass the course or not? Did you earn those credits? Do you get to move on to whatever's next? And so if we think about the comments on your homework and the final exam grade, really those two should be linked. So the comments that students are getting back on their homework should help them figure out how to improve, what else they need to work on, what ways they're doing well to be able to get ready for the final exam. And so if we take it into a medical education context, it should be the same way. Those formative assessments should really be directly linked and anticipating that summative assessments that are coming at the end. And so really the formative assessment should be useful in helping the student figure out how they're doing and how they can improve. So continuing on with formative assessment, what is the LCME's expectation about formative assessment? And you can think about what you think the answer to this question would be. Is it A, it's required of all clinical clerkships? B, it's required of all clinical clerkships longer than 4 weeks? C, it's required of all preclinical courses and clinical clerkships? Or D, it's required of all preclinical courses and clinical clerkships longer than 4 weeks? So what do you think the answer is? Well, it's actually C. It's required of all preclinical courses and clinical clerkships. So the element that's focused on this is element 9.7, formative assessment and feedback. And the expectations from the LCME are that each student is assessed and provided with formative feedback, and that formative feedback has to occur early enough to allow sufficient time for remediation. And that early enough is specifically defined as at least at the midpoint of the course or clerkship. So these are the expectations. Now, there is a caveat for courses and clerkships less than 4 weeks. And that's why there was a 4-week designation in the answers we just reviewed. And so for courses that are shorter than that, they do allow them to have some alternative means by which students can measure progress. It may not be in the same way as other courses or as formal as other courses, but they still have to have a way that they are addressing formative assessment and feedback. So that's still an expectation of the LCME for all courses in all phases of the curriculum. Now, when we think about formative assessment and feedback, you may not realize all the different things that could be encompassed under that umbrella. So in clinical clerkships, we often think about a formal feedback meeting. And in fact, that is our expectation of all the clinical clerkships and the acting internships, is that they're going to meet with students halfway through, have some kind of one-on-one meeting with a faculty member, talk about how the student's doing, talk about how to improve. But there are other ways to have formative assessment and provide that feedback. So another one could be quizzes periodically along the way, where the student gets to measure their learning, see if they're on track towards mastering the content. Another could be audience response questions in a class, where students are answering these questions, seeing how they do, seeing if they understood that material well enough. Another could be study questions that students are assigned to work on their own time, and then use that for self-assessment and gauge their progress. Another way could be active learning sessions where they have to apply the material, like a formative OSCE with standardized patients, or a simulation where they're implementing the content they've learned, they're practicing skills, and they're getting feedback about how they're doing and how they need to continue to improve. You can also have classroom-based active learning sessions, like team-based learning, for example, where they're getting feedback about how they're doing, how did they perform on that assessment, on that activity, and then they also know how they can improve. So all of these are different examples, and this is not an exhaustive list, but it gives you an idea of all the different ways formative assessment and feedback can manifest in courses. Importantly, it's really helpful to label these as feedback so that students understand this activity, one of the central purposes of it is to give you feedback so that you can assess how you're doing, so you can see how you need to continue to improve, so that you're ready for the summative assessments that are occurring later in the course. And in fact, the LCME in this element, you can see, refers to it as formative assessment and feedback. So they view this as completely linked. So on our ISA, that's that survey of students by students that is part of our LCME preparation, there are questions that are asked of the students about formative assessment and feedback. And specifically, the students are asking their peers, is the amount of formative feedback sufficient to assess how you're meeting expectations? And does the quality of it allow you to identify areas to improve? So keep that in mind, that they're asking the student perspective about the amount of formative feedback and the quality. We also have a formative feedback policy, which says all courses and clerkships need to have a way that students receive formative feedback early enough in the course and clerkship to recognize deficiencies and modify their preparation to achieve competency. At a minimum, faculty must provide formative feedback by the midpoint. And so you can see the language in our policy directly mirrors those points from the language that I had pulled from the LCME. And I could imagine during a site visit, an LCME site visitor might ask you as a course director, clerkship director, how do you provide formative feedback to students in your course? And so think about how you would answer that question and how you would describe the different ways students get formative feedback in your course. Okay, now let's transition to summative assessment. So there's a separate element on this, 9.8, which is fair and timely summative assessment. And that previews two of the important concepts the LCME is going to emphasize. And so one of those is it fair? And by fair, the LCME means summative assessments are linked to course objectives and content. So how you say that what you say the students have to learn and what you teach them directly aligns with how you end up doing the summative assessments. And it's clear to students how those summative assessments contribute to their final grade. So how are you using whatever summative assessments, the exams or whatever other summative assessments you're using in your course, how do those end up contributing to the final grade for the student? In other words, what you say that the student needs to be able to do in your course needs to be directly aligned with how the student will be assessed. Those two things should be perfectly aligned. So that's one concept, is it fair? The other is it timely? And by timely, we mean final grades are submitted within the deadline. And so for us, that's within 4 weeks. We need to have all grades for courses submitted within that deadline to be timely. So those are the two concepts that the LCME really prioritizes, as you can see from the title of their element, is the summative assessment, fair and timely. There are also questions on the ISA for students about summative assessment. And we gauge the students' perspectives about whether the summative assessments are pertinent to the course objectives and content, and whether the manner in which they're used to determine grades is clear and consistent. So you can see these questions are directly getting at the student perspective about the fairness of summative assessment. And this is one of the topics that we wanted to emphasize because this is a topic that has increasingly led to unsatisfactory ratings by the LCME on this element 9.8. So you can see that over time, there have been more and more schools that have been marked as unsatisfactory for summative assessment. So it's definitely worth paying attention to. So in summary, we have assessment of students, and then we have evaluation of the curriculum. And the assessment of students breaks down into formative and summative assessments. And so when we think about a student's progress through the course, we have summative assessments that need to be fair and timely. And by fair, we mean that they're linked to the course objectives, they're linked to the content, and that they are clearly determining the final grade. And we need to have them be timely in that the final grades that the summative assessments are used to determine are all submitted on time. We also need to have formative assessments built out throughout the course. And that means that formative assessment needs to happen for every student and every course. At a minimum, it needs to happen at least by the midpoint of the course to allow the student sufficient time. And so the amount and quality of the formative assessment need to be sufficient that the student can self-assess and improve and see, how am I doing? How can I continue to get better and get ready for what's coming at the end? So I hope this is helpful, unpacking assessment, getting ready for LCME, and sort of thinking about what are the expectations of LCME and what kind of questions could I anticipate. So I hope you continue to join us for future episodes.